Hey guys, Dr. Brandon Crawford here. I'm the founder of the Austin Center for Developing Minds. We are located just north of Austin, Texas in Cedar Park. And what we do is we focus on developmental functional neurology. Hopefully you'll have a chance to catch my lecture because I'm going to be taking you through what that process looks like and why it's so important to focus on rehabbing the brain in the right way, at the right time, with the right frequency and oscillations and all this kind of stuff, right? So I'm very honored to be a part of this conference. This conference is very meaningful. I love all the people involved, and obviously the cause is fantastic. So thank you again, and I look forward to seeing you soon.
Okay, hello. My name is Dr. Michael Reardon, and this is Brady Reardon right here. And I'm a child neurologist with Child Neurology Consultants of Austin. I've been practicing in Austin for about 15 years, since October of 2005. And we're here today because almost a year ago, on October 20th, 2019, Brady was involved in an accident and had a severe TBI, traumatic brain injury, among a lot of other injuries. And I am grateful to be able to share our story about Brady's recovery so far. And Brady, I think, is happy to be here to participate a little bit. Brady, can you say hey? Yeah, good try. Can you wave if I take your cup? Can you give a wave? Can you give a hook 'em horns? Can you do hook 'em? Show us a hook 'em. Can you raise it up? Raise it up. Come on, get it up. There it is. All right. So we do a lot of communicating and stuff with Brady's iPad. And like, for example, we have an app there's something called I Can Do apps, and it has a yes, no, so that's pretty convenient. So, and let me make sure sorry, I meant to check and see if the volume was turned up here. I'm terrible at technology. Hang on just a second. I know here's volume. Okay, it's all the way up. So hey, Brady, can you point to yes on the iPad? Point to the word yes. Where's the yes?
No.
Brady, where's yes?
Yes.
All right. So hey, Brady, do we have your permission to tell your story?
Yes. Yes.
Give a presentation. Yes. Are you okay with that? Okay.
Yeah. Yes.
And that even if I show some pictures of you and they're on YouTube, is that okay?
No.
No, you're going to yes.
Yes.
Okay.
Yes.
All
Yes.
right. So let me ask you a couple questions, Brady. Do you live in Dallas?
No.
Okay. Do you live in Austin?
No.
Do you live in Austin?
Yes.
All right. Do you go to Lake Travis High School?
Yes.
All right. Do you play football at Lake Travis High School? Are you on the football team? Brady, are you on the football team at Lake Travis High School? Where's the? He's hitting no, but I'm not sure.
No.
Okay.
No.
Do you do theater? Yeah. He's touching yes. There it is.
Yes. Yes.
Right.
Yes.
Are you okay if I show some video clips of you doing theater? Is that okay?
Yeah. Yes.
All right. So I'm gonna just show a couple of quick video clips of Brady. So this is Brady in 6th grade when he was in the Lake Travis High School musical and basically stole the show. All right, and this is Brady in 10th grade when he was 15 as the lead in the Lake Travis High School musical Footloose. Let's see. And then this is Brady. Spring of 2019, May of 2019, when he was 16. You like watching videos of your old performances, right, Brady? We usually don't have this issue, but just a little bit right now. I'm just going to give you a little wipe here. Okay. All right. Sorry about that. So, hey, Brady, do you believe that you're going to be able to sing again? Do you believe that you'll be able to sing again someday? You want to give me an answer? You're not sure? Are you working on it? Are you practicing? Well, it's hard to predict the future. We're not really sure, but we're definitely working on it, right, Brady? When you say you're working on it all the time? Yeah. Can you hit yes? All right. Well, and one thing that happens fairly often is Brady's pretty reliable with using his left hand and answering questions, and then sometimes he kind of gets tired out and it gets harder. So I think, but he's really good at doing hook 'em horns, right, Brady? Yeah. Can you give us some eyebrows? Yeah. Another way that Brady lets us know that's like a yes or a positive. He gives us eyebrows. Can you stick out your tongue? Can you stick out your tongue? Can you touch your nose? Good job. All right, excellent. Okay, you can bring it down now. Don't touch your nose. All right, good job. All right. So I think at this point I will take a pause and move on to the formal presentation. So we can just pause the recording and I'll move on. Okay, I think I got the signal to start. So thanks for your attention. And I just wanted to just say that this is not a scientific presentation at all. This is simply me telling my story about what happened to Brady and what it was like for our family and how we've kind of worked through this. And I hope that something in here is beneficial for someone in terms of providing perspective and maybe some insights, maybe some examples of what not to do. And I'm just gonna lay it out there and tell the story of what it's been like. So you already saw some of kind of what Brady was like before the injury, but I have a couple of slides about that. I'm going to describe in quite a bit of detail, the accident and what happened to him in terms of the injuries. I'm going to talk about what it was like for him and us in the ICU, and then going into inpatient neurorehab, what it was like coming home, and just kind of a little bit more about where we are now and how things are going. So just a little quick whirlwind tour through Brady growing up. He was the third of three boys, so he kind of lived in the shadow of older brothers. Some of you guys kind of know what that's like, and just doing whatever his older brothers were doing. In sixth grade, as I showed you, he got a part in the high school musical, and his older brother was a senior, and they were in the musical together. That was really cool. He didn't get on America's Got Talent, but he auditioned, and I thought he should have made it on. He was great. He also played a lot of baseball up until through middle school. He was really into BMX biking. And this is Brady as a 14-year-old, his freshman year. And this is a year ago, with Brady starting his junior year. This is him with his production theater group at our house, going to celebrate the beginning of the year. This is homecoming with his friends and girlfriend, etc. And this is the last time that I saw Brady on stage. This was October 18th, Friday, October 18th, in the fall play. And that's Brady there. He played this hilarious character that thought he was Teddy Roosevelt, and we just had a great time seeing him on stage. That's his girlfriend, Yasmin, who was one of the stars of that show. And the final performance of the fall play was going to be Monday, October 21st. And on Sunday, the 20th, they had a cast party, Halloween party. And this is like the last picture that we have of Brady before the accident. And he was on his way home from this accident from this party when the accident happened. And I'm going to show some pictures that are pretty graphic of the accident scene and then Brady in the ICU. So if there's anybody that doesn't want to see the visual images that are pretty heavy, you might possibly want to just take a break for a few minutes and come back, or just bail out at this point. But this is going to be the accident itself. So he was on his way home. It was dark. It was drizzly. We just started getting calls about the time that Brady was supposed to be getting home from the party. We started getting calls from friends that they were kind of coming home from the same party and came upon this scene and saw that it was Brady's car. There were no witnesses to this accident. This car clearly hit Brady, and Brady's car flipped over, and he was smashed into a guardrail. Unfortunately, the driver of this car did not make it. We were told by the police that it took about 20 minutes for EMS to use the jaws of life to cut into the car and get Brady out of the car. We were told that once they got him out of the car, he was more or less unconscious. His jaws were clenched shut tight, so they were not able to get an endotracheal tube. So they had to cut a hole in his neck, in the cricothyroid membrane, to get an airway. They were not able to hear any breath sounds, which indicated that his lungs were collapsed. So they stuck needles in between the ribs to try to let air out and allow the lungs to inflate. They transported him by ground ambulance to South Austin Medical Center. And we were told that when he arrived, that the best blood pressure they could get was 40, which is not good. And they still couldn't hear breath sounds. The trauma surgeon immediately put chest tubes in to allow fluid and air to come out and allow the lungs to inflate, and got a proper airway through the mouth, and was able to get his lungs ventilated and get his blood pressure up. And this is a picture of Brady a couple days in the ICU, but it gives a pretty good visual image of what all we were dealing with. So from head to toe, Brady had multiple hemorrhages in the brain that were indicative of diffuse axonal injury. So this is the very first CT scan that was done on that Sunday night. And these white blobs that you see are blood. And there's a couple of kind of, they're not huge, and there's a few that are very small. And, it doesn't look like much in terms of the volume of bleeds, but when we see this kind of scattered, tiny little hemorrhages on a CT scan, we know that that is indicative of something called diffuse axonal injury or traumatic axonal injury, which means that brain cells have been stretched and sheared to the point that there's rupturing and little hemorrhages that happen. And what we can see on an initial CT scan is often kind of just the tip of the iceberg. And then the other aspect of this is that just the story of what transpired, of how long he was trapped in the vehicle and how long it took before they were able to get a decent blood pressure and actually ventilate. He went a long time without good oxygenation or blood flow to the brain. And so there's a huge concern for ischemic injury to the brain. The CT scans of the cervical spine looked okay. They did keep that hard collar, cervical collar on him until much later, until they were able to get an MRI to make sure that the spinal cord was okay, and eventually just found some mild ligament injuries, but no visible injury to the spinal cord. As I said before, both lungs were collapsed and he required chest tubes on both sides immediately. He had the CTs of the abdomen and pelvis showed some fluid that turned out to be some small perforations in the small intestine and the first part of the large intestine. His right index finger was crushed and broken really badly. His left humerus, his left arm, was broken really badly. Both thigh bones were broken, and the most urgent, pressing emergency was that the left femoral artery, which is the main artery supplying blood to the left leg, appeared to be torn. They weren't seeing blood flow to the leg, and so that was a big concern that he might lose his leg from lack of blood flow. His right ankle was broken really badly. It's called a pylon fracture, which means the bottom of the shin bones and the top of the foot bones were all shattered. The left shin bones were also broken, and then the left calf would end up having some injury from the lack of blood flow. So Brady basically spent the rest of the night, overnight in the operating room. And by early morning, we got reports from all the various surgeons that were all pretty favorable. So they were able to reconnect the left femoral artery and restore blood flow to the leg. And he would, they basically saved the left leg. Since they were in the left thigh anyway, they pinned the left femur thigh bone. Then there were some small perforations in the intestines that they sewed up, and that all seemed to be fine, and they closed up the abdomen. And so then we went up to the shock trauma ICU at South Austin Medical Center, which is called the STICU. I really didn't like that term. It took me a while to get used to that, but eventually we just all started calling it the STICU because that's what it was called. I was very, very impressed and grateful for everybody in the STICU. What became apparent, during the first day was that these guys were fighting like hell to save Brady's life. It was really, really hard work. As the day went on, on the 21st, we kind of realized that the doctors, and like this guy, Dr. Peterson, and another trauma surgeon, Dr. Glazer, were realizing he was sicker than they would expect, which indicated that he had sick tissue, like dead or dying tissue, somewhere in his body, either in the left calf or in the intestine or both. So they had to take him back to the OR, fairly urgently by the end of the afternoon, and it was both. So they ended up having to cut out some of the intestine and leave the bowel, what's called in discontinuity, meaning they didn't reconnect everything. They just left the open ends kind of in the abdomen and left the abdominal wound open so that they had easy access to that over the ensuing days, and they could kind of go back in and check. And just over the next 2 or 3 days, we were just repeatedly faced with difficult news. So the ischemic tissues, as I mentioned, there was lots of fluid and blood losses, like he was losing. So the left calf had to be really opened up. There's something called compartment syndrome. If you have injury to the calf, there's connective tissue in there that holds everything in place, and if there's swelling, then that swelling has nowhere to go. So arteries and veins and nerves get squeezed and damaged. So they have to kind of cut everything open and allow things to swell. And there's fluid losses through there. There's blood losses through there that they're trying to manage. You got tons and tons of pints of blood, lots of complicated kind of fluid management. And as expected, more or less over 48 to 72 hours, the pressure inside the brain increased. That takes time for that to evolve, and usually is kind of hits the peak around 72 hours and then crests and starts to settle back down. They, as is typical for this kind of situation, they had what's called a bolt in the skull to monitor pressure, and they started to see that the pressures were rising. Eventually, they put what's called an EVD, an external ventricular drain, into the ventricles, which is the compartments where the cerebrospinal fluid is produced and then circulates, to help siphon off some of the fluid and try to equalize pressures. He ended up, this is the 7th CT scan that he got in a matter of, I think, 5 days, because they just repeatedly have to keep checking because of spikes in intracranial pressure, and kind of just making sure or checking to see if the hemorrhages had worsened or new hemorrhages were developing, or if there was herniation or anything that needed, an emergency neurological, neurosurgical intervention. What we can see from this CT is there aren't any new areas of hemorrhages, and there's not any kind of massive enlargement of hemorrhages. There's sort of a white dot here and kind of a streak that shows the drain going into the ventricles here. There's dark areas here and here that indicate like swelling or injury, but a large area of the brain that looks okay from what you can tell. But as we got through the first week, the main potential strategies for trying to keep the intracranial pressure under control. I'm going to try to explain this in a coherent way. One is elevation of the head. Anytime they laid him flat, the pressures would rise. Another is like heavy sedation. So they were giving him Versed and propofol to basically put the brain to sleep, to decrease metabolic activity, to decrease the stress on the brain cells. So it's difficult to assess, his neurological functioning and status through all of this, but as often as possible, or once a day, they would try to withhold sedation and allow an opportunity for him to wake up a little bit and try to assess things. And for the first 7 days of this, there was zero responsiveness. There was absolutely no movement. With deep pressure to the nail beds or the sternum, painful, what we call noxious stimulation. There was no response. There's no response to light in the pupils. There's just nothing. The only thing that the nurses could say is that he would occasionally have a cough reflex when they suctioned his trachea. But by the end of 7 days, I was becoming very, very discouraged and really starting to lose hope that there was any chance for any kind of meaningful recovery. So it was just, I just got into a very, very dark place. I can't even articulate or express, how nightmarish this was, but I really thought that we were losing him. And I really started to doubt and question whether we were doing the right thing by continuing to do all this heroic care. So one thing about that is I was doing rounds with the ICU team every morning, and they were great. At one point, they would always ask me at the end of rounds, like, do you have any questions, anything you want to say? And it got to a point where I just asked them through a lot of tears, like, should we be doing this? Is this like the right thing to be doing to keep trying to save Brady's life? And every single person on the team was like, yes, we don't give up. We've seen this before. There's a lot going on right now. You never know. And they were just very encouraging to me to just hang in there. About that point, I also just asked for some kind of palliative care consult, because I thought it would be helpful for Whitney and I, Mom and I, to just sit down together with another person and just talk this through and think it through. And Whitney, Mom, she had no questions or conflict whatsoever about any of this. I mean, she was 100%, 1,000% emphatically we're going to do everything we can for Brady, and we're going to pray, and he's going to get better. That was her mindset. And the palliative care nurse practitioner that met with us she was great, and I think she just did a really, really good job of talking this through with us. And she asked me, probably both of us, but she asked me, she asked each of us kind of where we were mentally and, psychologically and what we were thinking about this. And I was just expressing just my concern that about, whether or not there was any chance or a reasonable chance for Brady to recover from this. And she asked me, if Brady could speak for himself right now, what do you think he would say? And as soon as she asked that question, the answer felt very obvious to me, very clear, that the answer would be, just give me a chance. And so from that moment, on, there was no question about it. I was completely all in, and we were pushing ahead and doing everything that we could do to save Brady. And it was like, I think it was on that day that for the very first time, Brady started withdrawing to stimulation. And then he had pupillary reflexes to light. And then a couple hours later, he started moving spontaneously. So it was quite an experience. So that at least I knew at this point that, he wasn't brain dead. There was something going on in there, and it was changing, and that we had a chance. So we just kept pressing on. I'm taking a long time just to get through the very beginning, but the other major thing that we had to deal with over these, kind of once we were several days in, was the storming, what's called neurostorming or storming, which involves very high temperatures, like in the range of 104, 105, 106, very high blood pressures and heart rates. So scary stuff. He was constantly on cooling blankets, and there was a machine that you could see how hard the machine was working to keep his body temperature at like 103. So that was very difficult as well. I want to kind of get to the rehab stuff, but I would just say that during the time that we were in the ICU and ongoing, we were just flooded with love and care from all over the place. It was quite amazing. We basically lived in this family room that was right outside of the ICU, and there were constantly people in there. I felt bad all the time because there were so many people coming in there, bringing food, 3 meals a day, every day. It was like Luby's in there, the food that people were bringing. And at least we were able to feed like other families that were showing up, and we would, they would cut us a little bit of slack for having so many people there. The other thing is that, we didn't see our house for a week, and we were just repeatedly told, like, don't worry about it. We're taking care of it. We're taking care of the dogs. There's nothing to worry about. And it was the same thing at work. I mean, everybody in my practice just was repeatedly telling me, don't worry about it. We've got you covered. Your patients are fine. Everything is fine. Just do what you need to do. So we're just very grateful for the support that we got. It was incredible. Just I wanted to comment that we kind of had differing needs to some extent. And Whitney really needed people to be there and to have company. She constantly had friends there with her and comforting her and talking to her, and she needed the conversations and the company. I would get to the point where I couldn't stand being in that room any longer, and I would just have to get out of there. I needed to be in Brady's room, in the ICU room, getting all the details, knowing exactly what was going on. And I needed to be able to write it all down, and I needed to go on very long walks, and I needed counseling. And I was fortunate to have a therapist that would talk to me on the phone, and I got a fair amount of free counseling over those first few weeks. Just to kind of wrap up our stay in the STICU, Brady did start to wake up a little bit. He did start to open his eyes and look around a little bit. It wasn't much, but it was a start. So one thing was the tracheostomy. I did have a difficult time with this because with a lot of my experience as a neurologist, when someone is in a coma and they're intubated and they're not able to be extubated and breathe on their own, well, then that's really, really bad. And, if you're having to convert that to a trach and vent, what are we really doing here? Like, what's the purpose of this? If, that's not going to be associated with a good outcome. And the ICU team was just very strongly encouraging and, reinforcing, like, this is just part of the deal. He can get better, but we need to get the endotracheal tube out, and and it just makes life easier in so many ways in terms of his medical management if he has a tracheostomy. So that was, a hurdle for me to get over, but that was what was going to happen. And so we got that done. Another big issue was the intestinal injuries and how they had to deal with that. So this is a much later picture, but this is Brady's abdomen. Okay, this is the G tube here. So this would be where, roughly where Brady's stomach is. So the small intestine is going to come out of there, and they attach the small intestine to the abdominal wall here. And the thing is they, in the midst of all of this trauma and illness, and there's a high risk that if they just connect the intestines back together, that it's not going to take, that there'll be, that the tissues won't heal well and there'll be problems. So they just attach the outlet of the small intestine to the abdomen, and that's where the poop comes out. And then this hole here is where the large intestine, the colon, starts, and that goes down to the rectum. So, eventually later down the road, when he's healthy and the dust is settled, then these can be reconnected and you can have a normal bowel. In the meantime, they have to attach a bag here that collects the stool, and then that can be, emptied out, and the bag can be replaced. And one thing that was going on is that, in the beginning, this was being applied where here along the middle was a long, gigantic open abdominal wound that was being packed with dressings, and they had something called a wound vac, and it takes a long time for that to heal. So as you might imagine, I had a tremendous amount of stress and angst about the fact that, it was challenging for the bag to be adhered to the skin and not leak into the abdominal wound. And it was, I experienced a lot of stress and aggravation over this situation. But I'll get to, like what it's been like down the road a little bit later. We were able to get an MRI, and that was when we finally got to the point where the intracranial pressure, the pressure in the brain, was settling down and wasn't spiking every time he was lying flat, which was challenging every time they had to go back to the operating room to fix the broken bones and whatnot. And to get an MRI, you have to lie flat on a table for a pretty long time, 45 minutes or an hour. And so we had to wait until he was much more medically stable and wasn't going to have spikes in his intracranial pressure, and we could get an MRI. This is a pretty good picture of what we were facing and what we were dealing with. And the one aspect of this is I had a tremendous amount of relief when I saw this, that it really wasn't showing a lot more than what we already knew from the CT scans. We already knew there was blood here and blood here and blood here and bruising and swelling and all of that. And there's just large areas of cerebral cortex and cerebral hemispheres that look pretty okay on the MRI. On the other hand, definitely this whole section here that we call the basal ganglia does not look too healthy. It's brighter than it's supposed to look. And by the way, this is the left side of the brain. This is Brady's left, and this is Brady's right. So the left basal ganglia looks pretty injured, and there's blood and swelling in there. The right thalamus looks pretty injured, and this part of the basal ganglia called the caudate. So these are areas that are very heavily involved in initiation and coordination of movement. And while it's a relatively small area of the brain in the grand scheme. Um, Basically, all of the stuff that like the frontal lobes are doing in terms of motor functioning and executing actions and things like that, all of them depend on circuits that run through the basal ganglia and thalamus and back in order to initiate and coordinate and control actions. Um, so this can be devastating to have all this basal ganglia injury. Um, the way I just tried to look at it was he's got these big blobs of blood and swelling in here. And I know that over 6 to 8 weeks, that's going to settle down and the blood's going to get broken down and it's going to shrink down. And I'm just going to hope and pray that over when that starts to happen, that there'll be some viable functioning brain circuits in there that will be able to work and that he'll start being able to move and things like that. I'm just going to move on at this point to just going into inpatient rehab. We had, a few potential options. There is what's called TIER, a pretty renowned brain injury neurorehab in Houston. There's Texas Neurorehab, which is in South Austin. There's Dell Children's, has an inpatient rehab. But one of the things, one aspect of this is that before Brady could really be an active neuro rehab, he still needed a lot of medical care. So what's called LTAC, long-term acute care. And so we need, he was going to need that. He would no longer, he was done with all of his surgeries and he didn't need to be in the ICU anymore, thankfully. But he was going to need he was going to need to be someplace that had LTAC. And so for that reason alone, Texas Neurorehab was kind of the obvious choice for us. They have LTAC on site. They have a respiratory wing where they have ventilators. It's all patients with tracheostomies. They have the respiratory therapists and all of that. They have a pulmonologist, internist who oversees all of that. They have a wound care specialist and wound care team that can handle all the wound care. They have a neurologist that's on staff, they're daily rounding. They have a physical medicine rehab doctor that's there rounding on patients. So lots of medical care available. And then they have the rehab that can start gradually getting introduced as things move along. It was also 10 minutes, it's 10 minutes from my office. So basically it's a 20 or so minute drive to my office and then 10 minutes from there to Texas Neurorehab. Or, I can spend the night at Texas Neurorehab and it's a 10-minute drive to work and 10 minutes back. So it was extremely convenient. It was far and away the most convenient situation for us from our home and for all of Brady's friends and all of our people, it's also has like 40 acres of nature surrounding it that for me was really helpful and healing. I think that they have a good reputation, particularly just in terms of the quality of their rehab services and their therapists. I have some inside scoop on the place, which led me to believe that there was good quality care there. Basically what I was told is it's good that you're a doctor. You'll probably get a little bit of extra attention, and you want to just be keeping an eye on things in terms of the day-to-day nursing and attendant care. But it was a clear choice that we were going to Texas Neurorehab. So here we are, middle of November, and this is our first weekend at Texas Neurorehab, and we are very thankful to be out of the ICU, thankful to be able to take Brady outside, to bring our dogs up. He had his eyes open, he's looking around at stuff. He didn't need to be on a ventilator anymore. We were able to take him outside and go around, and he was stable from a respiratory standpoint. We were really thankful to just have some space. This is a shot of, this is inside of Texas Neurorehab and kind of the family area. We were no longer in a situation where Brady was stuck in an ICU room, and we were all stuck in this little cramped family room. We could all be together. And here's Brady in his chair, and he has a friend sitting with him, and here's Whitney with a friend, and our oldest son Tanner, and we're all hanging out together. I had this to go out to when I needed a break from stuff, and I was very grateful for that. We were far from out of the woods. I mean, Brady did need trach care. There was a lot of wound care, and there was continued storming. So we still had a lot of problems with these high temperatures, high heart rates, needing medicines to try to keep that under control. This picture, I think, is actually from December, but it just illustrates kind of the scene, like cold washcloths on the head and fans blowing, and we're trying to wipe away sweat and keep him cool. And but over time, there was improvement happening. His trach decannulation went quite smoothly. This is towards the end of, I think after Thanksgiving. You can see that he doesn't have the trach tube in anymore. He just has a dressing covering the hole. And more and more over time, Brady was just watching everything. By this point, Brady had not really shown any facial expression at all. I mean, really just had a blank look, and he was just looking around and watching everything. One little encouraging development that happened like the very last day of November is that we were outside for our usual kind of evening walk. And I said, Brady, look at the moon. It looks really cool. And I think I just kind of positioned him, but I could tell very clearly that Brady's eyes locked on the moon. And it just gave me some hope that, like, okay, he is actually discerning something visually in his environment. He can see that and kind of respond to it in that way. And another thing you can see from this picture is the dressing over the trach is getting smaller. That's healing up. He's also got an IV in his arm. And the only reason he had an IV at that particular time was because of the storming causing so much sweating that he's getting dehydrated, and they're needing to replace his fluids. And that didn't last much longer. So that brings us to December. And it was early December when he finally started to move something, which was his left hand. And he would, at least with like prompting and like visual prompts, he would give us a thumbs up with his left hand. And if we, tried to give him, asked him to give 5, he would reach out and put his hand on your hand. So he was starting to have some motor activity and responsiveness. It was on December 9th, which was the first time that it was very evident to me and very clear that he was responding to a verbal command, that he understood what I said, which was, I was with him in his room it was just the two of us. And I said, Brady, I don't know if you can understand what I'm saying, but if you can understand me, open your left hand. And he went, boom. I was like, yes. And I was like, okay, close your left hand. And he closed it. And then very soon after that, he got the most horrific look on his face of just like terror, agitation. He was like, it was like a silent cry. It was very upsetting and disturbing. And I just think that maybe he was having a moment of lucidity, that he was just like, kind of woke up and was like, where am I? What's going on? I tried to just talk to him in a very comforting way. And I'm like, Brady, you had an accident, but you're safe. You're okay. You're going to be fine, and he did settle down. And then after that, he was kind of back to just being kind of mellow and eventually went to sleep. our neurologist suggested that maybe this kind of facial expression was pseudobulbar affect, which is sort of like basically an involuntary reflexive emotional expression that can happen with brain injury and brain disease. And basically this kind of expression was starting to happen more and more in December. And I can't say for sure, but I really thought that it was him waking up and being kind of appropriately distressed by his situation. Over the course of December, he really started to tighten up, and spasticity became a big problem. You can see his right arm flexed here, and he got a lot of Botox in his right arm and pectoralis. It was a real struggle trying to stretch and maintain range of motion, especially in the right arm. You can see him here sitting with his mom, and he had this terrible break in his right finger, and there was a pin in the right finger, so it needed this heavy plastic splint to protect all of that. And then he was constantly pulling that right hand up into his chest and neck and face. It was a real struggle to keep him from hurting himself with that thing. So that was just a real challenge. But one of the things that happened over the course of December is that it started to become evident to his therapist that he was hearing them and he was responding to them. And I think it was by the end of December that he did qualify in terms of meeting the criteria for active inpatient rehab. So that was positive. He was also making pretty decent progress with his oromotor movements and handling his secretions. The speech therapist, Joy, was great at working with him. And so on December 24th was when he was cleared for us to feed him ice chips. So that's what I got to do on Christmas Eve, and we could flavor it with like Coke or root beer, Dr. Pepper and things that he liked. But at this point, we were still not getting much of a response from him. I mean, we were really just doing the best we could to surround him with love and care. And this is us Christmas Day. And at this point, he's still the only kind of emotional expression or response that we had gotten out of him was this occasional kind of crying and distress. And then on December 28th, this was the very first time that Brady smiled. We were all sitting around his bed right here playing Old Maid, and which is like, it's kind of like Uno. It's like a game that never ends. But finally, his brother Wilson was the one left with the Old Maid card, and he lost. And all of a sudden, we hear this kind of like kind of noise that I thought Brady was coughing or choking, and we all looked, and he was laughing. He was like snickering, and he got this big smile on his face. And by the time I got my camera out, the smile had kind of faded quite a bit. But this was the very first time that Brady smiled since the accident, and it was pretty evident that he knew what was going on, and that it happened. The timing of it was appropriate. He seemed to know what was going on, and this was incredibly encouraging for me that things were getting better. Like, he was in there cognitively and was able to have some comprehension of what was going on, and able to have some, it was so great to see him smiling. I can't even tell you. I was really looking forward to the next day and the next day of seeing that, but I will say it was the next day he was back to kind of no expression. And it was 9 days until the next time that he smiled. So the very last day of 2019, I was out for an evening walk, just very uncertain about where all of this was going. I'm going to just try to move along by saying, like, over the course of January and February, he did start to wake up, and I would say he started to emerge from what was kind of a minimally conscious state. This is him getting E-stim. This is him kind of enjoying a lollipop that seemed to perk him up. This is him going for heel cord lengthening procedure, which went very smoothly, and he recovered very nicely from that. And over the course of January, we started to see a lot more of this. And here, this is usually, it was his friends showing him TikTok videos that would get him smiling and laughing. And he started to kind of seem like he was enjoying being at music therapy. And this picture reminds me that I've kind of like forgotten to talk about something that was early on, like very early on when he was still in the ICU. They started him on amantadine and methylphenidate, like Ritalin, stimulant, to try to help wake him up. And I just felt really doubtful about it, but I didn't want to stand in the way of what doctors were recommending, and kind of interfere or alter the course of his treatment. And I think that the doctors wanted to give him every possible opportunity to be awake and have a chance for attending and responding. But over the course of January, he was definitely starting to wake up more and becoming more responsive. But we had lots and lots of times where he was really irritable. And one of the things we started to just notice a lot of it in the morning. He would wake up. He would need a lot of medication just to help him sleep. He started to be on baclofen to decrease his spasticity, and we had high doses of baclofen to get him to sleep. He was on gabapentin to help him fall asleep. And then in the morning, he would get amantadine and Ritalin, and he would wake up and he would start crying. And I asked them to wean him off of the amantadine, which they did. And I thought maybe that helped a little bit, but it was still not that much better. And this picture is the very first morning that we didn't give him Ritalin, methylphenidate. And he woke up and he smiled at me and he was just relaxed and he just seemed totally fine. So this wasn't the end of it, and we still had issues from there, but there was clearly an improvement in his comfort and affect after we took him off of the stimulants. This is the very last day of January where he went for his follow-up from his heel cord lengthening surgeries, and he got these fancy boots to help keep his feet and ankles in a good position. So this was going to be February, because it was going to be the very first time that we were going to start being able to put him on his feet and have him bear weight. This was February 2nd. Just to note that this really felt like Groundhog Day, because here we were again late at night with him, like really irritable, not knowing what it was. Was it just neurological, just agitation? Was it his spasticity? Was his ostomy bothering him? The skin around the ostomy would get irritated, and we thought maybe that was it, but it was really, really hard to know. But this was just a night where I felt like we were stuck in just an eternal nightmare. But then here we were 2 nights later, and he was just happy as a lark, enjoying company. Here he is, early February, this is the very second time that they got him up on his feet with a lot of support and a stander. He was generally very unhappy about that. I think probably at first his feet and ankles were very uncomfortable. He maybe was scared. But in the first month or two, this was challenging. He was a lot happier sitting in his chair. Here he is just enjoying music therapy and his friends goofing around. This is him laughing at his brother Tanner, inhaling helium from a balloon. This is him just enjoying a lot of company and what we have come to call Brady's ladies. This is the very end of February, and over this course of this time, we were able to feed him more and more. So like yogurt, pudding, like slushy kinds of things. He was able to eat with a spoon and like really happy, like loves getting like milkshake and yogurt and pudding and things like that. So over the course of March, things were starting to look brighter. This picture reminds me that I would catch him, we would catch him like looking at all the stuff on his walls. And it was somewhere in early to mid-March that I realized that he could read. Like I would write stuff on a dry erase board that were like, something funny from his past or like a joke, and he would look at it and laugh appropriately. It was just very, there were almost no commands that he could follow. Like he couldn't follow a command very well because he just couldn't get himself to execute a motor function on command. But I knew that he could read because of his laughter at something that I would write. The other thing that was a big development in by the middle of March is he started to drink through a straw. So we were spoon feeding him a lot of stuff, and I was starting to push the team. Like I think we can start feeding him like real food or at least pureed food. And he was still on G-tube feeds at the time, and there was quite a bit of resistance from the team. Like he's not ready. It will be hard to get enough calories in him by oral feeding at this point. He needs to have his tube feeds. And when he got to the point that he was drinking through a straw, I was like, okay. I grabbed one of the cans of tube feeding formula out of there and shook it up, cracked it open, tasted it, and found that it tastes pretty good. It's like a vanilla boost. So I put a straw in it and I said, "Here, Brady," and he like drank the whole thing down. So I, informed his care team, like, you don't need to give Brady tube feeds anymore because he can drink the stuff through a straw and he likes it just fine. And so that's what finally kind of pushed them to go ahead and order him a tray. And it was like Brady was so happy to be able to eat some regular food. And he would just clean his plate. There was no problem at all with him getting enough calories. And he had enough tone in his right hand that I could put a spoon in his right hand and he would hold on to it, and I would just help him scoop it and feed himself. And he would do a little bit of the work, and over time that's gotten a little bit better, and I'll get to kind of how that's progressed. And then the other thing, we all know what happened in mid-March, which was COVID. And gosh, I mean, I could go on for so long about the progression, the transition of this, but basically what happened is, eventually total shutdown, no visitors. All of the friends that were coming to see Brady all the time and like playing music for him and singing to him and showing him funny videos and getting him to laugh, that couldn't happen anymore. And all the friends and family that were coming to help us out and bring us meals and all of that ended. And what it turned out to be is that from from late March through the rest of our stay at Texas Neurorehab, which was the end of May, only I or Whitney could be there with him at a time, with nobody else there. So things changed a lot. We did, lots of video chats, which were enjoyable for Brady. We did have our first test run of bringing him home to our house in the car, and that went great. We survived that. He was very happy to be home for a little bit. This is Brady the day after his birthday, March 29th, sporting a new birthday shirt, necklace, socks, shoes, really starting to look pretty strong and happy. And this is the last day of March. And by the end of March, Brady started to get a little bit better at using his left hand. Um, I'd mentioned that early December, he started to do a thumbs up and he started to reach his hand out. And then the spasticity kind of picked up and his left arm got stiffer and he kind of lost the ability to do anything for a while. Um, and he was on a lot of baclofen. We also started him on CBD in March and really cranked the dose of that up. And it helped just enough that he was, I think along with just the forward progression, he was starting to be able to use his left hand for some like meaningful communication or responsiveness. A few things that I would say were kind of blessings in disguise with the quarantine. It got a lot quieter at Texas Neurorehab. Things were a lot more orderly. We did have lots and lots of fun video chats with friends and family. Brady always enjoyed that, but we just were able to focus more on his therapy and also focus more on sort of his personal needs. It was challenging when there was like always friends there and kind of crowds of people. Like, has he peed? Does he need to go to the bathroom? Does he need to have his ostomy bag changed? And is he comfortable? And it was just kind of hard. And once we were just always one-on-one with him, we were kind of able to focus on some of that stuff. And he started to actually develop some bladder control, and he was able to go into a urinal, like a bedside urinal. The the other thing that was a big part of this is like I was becoming increasingly frustrated with the ostomy and like just that it was hard to keep a bag adhering to the skin properly. It would leak. Um, it seemed to irritate his skin around the stoma site. I just couldn't wait to get this thing reversed and get back to normal bowel functioning. And I was naively optimistic that, like in the next month or two, he'd be getting stronger. He'd be able to use a commode. We'd be able to manage this. He was starting to get some bladder control. Like this was going to work great. But as soon as the pandemic happened, any surgeries that were elective were shut down, of course. And this was elective. I mean, this was not something that needed to be done. And so we just, we also just reasoned that like, we don't want to be sending them off to another hospital and risking, COVID infection and all that stuff. So we just held off on that. And it really turned out to be the best thing for Brady and for us to just hold off on that. And then the last thing is that this was finally forced me to have some time by myself at home. I would spend basically 2 nights at rehab, and then Whitney and I would switch off, and I would spend a night at home. And I was working from home, and then I would just stay at home, and I got more rest and I got more sleep, and it was very helpful. And then being in this phase, it really got us to like be seriously thinking about like what do we need to do to get Brady home? Like we need to, he's not walking yet, he's not moving himself yet. He still has very limited movement of his legs. We have been hoping for a lot more recovery before we bring him home, but we just started to have to think about like we need to figure out what we need to do to get Brady home. So we started springing into action. We got his G-tube removed early April. We eventually decided to implant a baclofen pump because he was on so much baclofen. He was on a lot of CBD. He was still very tight, despite the fact that he was doing really well in a lot of ways, and like his mood was pretty good a lot of the time. Every evening, his legs were tight. He was uncomfortable. It was hard to get him to fall asleep. Once we got the baclofen pump placed, he was comfortable and happy almost all the time. We weaned him off of all of the oral baclofen. We weaned him off of almost all of the gabapentin except for a little bit at night. He wasn't getting any pain medication. We took him off of Cymbalta. We basically just, I mean, we were able to wean him off of all the remaining medications. We weaned him off of the CBD because we think the CBD was causing urinary retention, and that did get better after we weaned him off. So we got to a point where he had the baclofen pump going, and he was on a little smidge of gabapentin at night and a little bit of melatonin at night, and that was it. And he was comfortable and happy most of the time, and getting better at using his left hand. We also, in order to get him home, we needed to get a bathroom with a shower that we could get him into. So thanks to some help from Team Luke Hopeformines and some very helpful friends, we renovated our master bathroom. We basically gave Brady our master bedroom, and we renovated the bathroom so that we had a nice roll-in shower that was very handicap accessible. And we also wanted to start getting him prepped for getting in our pool. So just trying to summarize things we kind of had to prepare for going home. We got his G-tube out. We got him recovered from his baclofen pump. We got him weaned off of almost all of his medication. We basically became his techs at rehab and gained competency in all aspects of his care, including taking care of his ostomy. I finally kind of gave in and realized, like, this ostomy is going to be here for a while. I need to learn how to take care of this thing. I need to learn how to replace the bag and get it to fit right and all of that thing. And so I kind of became the person that was in charge of that. We kind of practiced getting him in the car. We got our bathroom renovations done. And then by end of May, we just had to order a hospital bed. We had to get a shower chair, make sure we had all of our supplies ordered, and we were ready to go. For outpatient rehab, we got Rehab Without Walls. So we got that referral going. And then finally, we started the process of getting him enrolled on this Medicaid waiver program called Home and Community Services, HCS. So what that means is Brady is on Medicaid, and Medicaid funds attendant care for him. So it took until August 3rd to get all the paperwork done and everything, all the enrollment done. But now he has 67 hours of what's called PASSHAB, personal attendant services and habilitation services. So this funding pays a little over $19 an hour for attendants to come into the house and help take care of Brady. So it's a huge help. It's taken quite a bit of time to kind of figure out how this works and to find a couple of people, and it's still challenging, but it's really, really helpful. So 7 months after the accident, finally we were able to bring Brady home. And Brady was extremely happy to be able to come home. It made a huge difference for him emotionally. I'll just say a little bit about what the summer's been like. We've spent a lot of time trying to avoid COVID exposures, but still trying to provide some social time and all of that. And Brady's been trying and accomplishing things. So this is like the first time that he was able to hold a cup and actually bring it to his mouth and take a drink for himself without any help. This is about the first time that Brady was able to feed himself something with some help from us. We have a stander at home, and these are some of the therapists from Rehab Without Walls, and they're amazing. So our insurance approved 60 days of rehab, and they can pack as much therapy as they want to into one of those days. So we have PT, OT, speech therapy, and a neuropsychologist that does cognitive therapy, and they all overlap, and they'll co-treat, and they're a great team, and they've helped Brady make a lot of progress. This is Brady starting to play video games with an adaptive Xbox controller, which his friends got for him. This is Brady finally getting his custom wheelchair. We didn't have this until July 20th with lots and lots of back and forth and needing to have revisions done, etc. But this is Brady trying to propel himself in his wheelchair very shortly after getting it. This is Brady just trying not to get COVID from his friends who come over and sit out on the lawn and wear their masks. This is Brady trying to play air hockey for the first time. This is Brady getting a haircut and trying not to get COVID from Whitney's hairstylist, who's graciously agreed to come to our house every once in a while and give Brady a haircut. This is Brady going in for more Botox and to have his baclofen pump adjusted kind of early August. And this is Brady in the pool, which has been just a real source of happiness for him. So here we are, fall of 2020, almost a year. Brady has started school. He's in the process of getting an IEP set up. He's had all of his evaluations. We have an ARD meeting scheduled for a few weeks from now. In the meantime, they put him on homebound. He's got 4 classes. He has theater and choir, and he has English 4 and a science. So he has a homebound teacher that's coming to the house once or twice a week to read to him and ask him questions about what she reads. And then they're starting to work on anatomy and physiology. And then he Zooms in for his theater and choir. And usually one of his friends has been able to come over and help get that set up and just kind of be with him, which makes it a little bit more fun for him. Our time with Rehab Without Walls is winding down, so we'll be kind of working with the school for some, for kind of ongoing services. His home and community services program, the Medicaid waiver program, it does have some ability to cover some therapy, so we're kind of working on extending his outpatient therapy through that program. And we still have a long way to go, but Brady is getting better at things. This is kind of where we are with his ability to feed himself with a fork. As long as it's something he can stab with a fork and it's low enough for him to reach, he can do that. And Brady loves music and loves playing the piano, and he knows the notes, and he can usually find a note that you ask him to find, or he can find a note that's playing if there's music playing. Here he is trying to play a C scale, but his right hand is getting in the way of his left hand. So he has to kind of push through that to get all the way up to the top, and then he's able to do that. So just really quickly, the pain, as you I think saw with some of my reactions to just going through the early days, the pain of this has been excruciating, but we've gotten through it. And this is a quote that I came across a couple months ago, that love rushes into the void created by loss. And that's exactly what happened. We were just overwhelmed with support and love and care from so many people that have helped us get through this. And all we had to do was just allow it to happen and accept it. And the thing that's been the most helpful for me in this whole process is just accepting reality, just acceptance of reality. This is what we have right now. And that, combined with the love that we have for Brady, has just led to what I think is usually effective and appropriate action. We've been able to overcome a lot of hurdles. For example, just the intimidation of some of the complex procedures, and particularly the ostomy bag. It was something that I just didn't want to touch, and I just wanted it to be over with and get it repaired, get it reversed, and move on. And I've become fairly good at managing this thing. Squeamishness about the wounds and bodily fluids, and awkwardness about bodily functions, nakedness. And, you might wonder, why would a doctor have awkwardness about this stuff? And it's just that, when our kids are little, you know, were all in their business with diaper changes and potty and all these things. And then they grow up and that stuff kind of becomes off limits. And, you know, for 16, 17-year-old, we're not supposed to be involved in Brady going to the bathroom and Brady showering. And I really had a lot of worries about, like, he's going to be waking up and we're going to have to be doing all these things and it's just going to be terrible for him. And the reality is, like, he just seems to roll with it and accept it. And we've all just kind of gotten accustomed to this way of life. And, you know, it's not easy, it's tiring, it's a lot of work. But we also get to experience a lot of joy just being with Brady and caring for him. And, you know, one of the big lessons that I've just seen is that everything just keeps changing. And so even in the most difficult circumstances that seem like it's never going to end, you know, things keep changing. Treating Brady's spasticity has really been one of the most important things that we've been able to do for his well-being, and getting the backlift and pump seems like that was the key ingredient. And like I said, we were able to basically wean him off of all other medicines once we got that going. And he's comfortable most of the time and like relatively happy most of the time since we did that. Texas Neurorehab has excellent people, doctors, the wound care specialists, the therapists, some excellent nurses and techs. You know, there's some hit or miss there. You know, I really feel like it only works if there are family members that are present and attentive and like gradually becoming, you know, maybe expert is not the right word, but just becoming proficient at the care that he needs. Rehab Without Walls has been amazing. And, you know, our family and friends and love and music and like games and jokes and desserts and the swimming pool have been the best medicine for all of us. Okay, and that's the end of my presentation. And I know you. I don't think you can hear this, but this is us all singing and playing music in the living room. And with that, I will stop talking and allow the presentation to end. Thank you for your attention.